Today we'll discuss about a topic called fibromyalgia. So whenever a female of reproductive age group presents with myalgia, neck pain, shoulder pain, etc., we have to keep a possibility of fibromyalgia. So what we have to do is we have to assess for index called widespread pain index. That is nothing but there are about 19 marked areas where we have to check for the pain or tenderness, and for each area we have to consider 1 point, and that will come to the total of widespread pain index. There is something else called as symptom severity score, which will range from 0 to 12 points. The major things in the symptom severity score are features of fatigue, difficulty in remembering or thinking, feeling unrefreshed after waking up, depression, headache, etc. So considering all these points, we have to calculate the total score. And one more important thing is the symptoms should be more than 3 months, and there should not be any other disease which can explain the features. So considering all these points, we can diagnose the case of fibromyalgia. Coming to the pathophysiology, mainly there will be elevated excitatory neurotransmitters such as glutamate, substance P, which will lead to anxiety. And on the other end, there are diminished levels of serotonin, noradrenaline, which will lead to depression. So these are the associated features which we can see in such females. And important thing is about modulators, that is dopamine. So any physical or emotional stress, whenever the stress will increase, the features of fibromyalgia will be obvious. And another defect in the fibromyalgia is there will be abnormality in the processing of the pain in the brain, and there will be decreased endogenous opioid analgesic system, that is decreased levels of endorphins, dynorphins, and enkephalins will be the reason. So coming to the treatment, we can advise for exercise and yoga, which will improve endogenous analgesic system, and we can advise for good sleep hygiene that will correct the imbalance of neurotransmitters. Some relaxation techniques should be advised, which will strengthen dopamine, which was the modulator. And there are some medications such as amitriptyline, duloxetine, pregabalin, etc. Here, one thing to notice is the treatment will not have NSAIDs or opioids. So unnecessary usage of analgesics for shoulder pain, neck pain should be avoided if we know about fibromyalgia. And important thing is we have to consider the closest differentials for this disease, that is hypothyroidism. So we have to get thyroid workup done, and some inflammatory myopathy or arthropathies. So raised ESR and CRP level will be the clue. Also polymyalgia rheumatica, which also contains raised ESR and CRP levels. And sometimes we have to ask about the drug history to rule out statin myopathy. So these are some closest differentials for fibromyalgia. Thank you.